How are you? Good. Okay, it's exactly 5:30, so are you guys ready? Are you pumped? Learn about break-free medicine? Okay. So welcome. Thank you for coming on this beautiful summer day. I appreciate you being here in this lovely air conditioning in this beautiful store. I want to thank Wendy for having me here today. This is the first time I've been here. You guys are really lucky. This is amazing. You got, your smoothies and your supplements, and there's a gluten-free grab and go. It's amazing. So for those of you who don't know me, my name is Sarah Labisco. I'm a naturopathic and functional medicine practitioner located right now in Albany, but I really see people throughout nationally. I do phone consults, so the location isn't really a big deal to me. But I'm really glad that you're here with me today. And today what I'm going to be presenting is my new book, BreakFree Medicine. It came out in the spring. And what it is, it's a compilation of kind of my own personal journey with what I've been doing with my clients for the past 9 or 10 years, as well as the research that I've been doing into natural methods and the evidence base behind them, as well as uniting the science and art of healing. So the goal of the break-free medicine approach is a combination of this naturopathic philosophy and the functional medicine systems model, which I'll go over so you guys know what those big terms mean. And what it is, it's meant to empower people so that they have the information about preventing disease, promoting wellness, and staying healthy, and moving from this kind of sick care model system, right, where we're kind of just watching and going to the outside in order to get our answers, but becoming more aware of how to stay healthy. And also kind of the goal of the book was as well is providing enough research and science to make the patients comfortable enough to bring this to their physicians. Because I think that in order for us to create a change in healthcare and what we're getting, we need to bring everybody together, not kind of have an us versus them philosophy. So I view this as more of like a bridge rather than a different way, if that makes sense. So these are kind of the main talking points that we're going to go over today. And also, if you guys have any feedback while I'm talking, I love questions in between because it brings, it makes you not want to doze off or go to sleep in the middle of it. If I'm just, standing up here talking to myself, I like to hear myself talk, but it's more fun to hear your feedback. So just feel free to just let me know if you have any questions. But I'm going to kind of go through my own personal journey and what had me start this break-free medicine approach and why we need a new way. So that's really important, right? So I'm presenting to you this new model, but you might be thinking, well, why can't we just, take supplements and eat better and be okay? And I'm going to show you where that's probably not the best idea, that there's more to it than that, okay? And then the principle behind this new model, as well as an example of how to implement it. So there's different systems that the book goes through and how to balance the systems one by one, and that creates an overall balanced body. I'm going to show you kind of a snapshot of that using the gut, the gastrointestinal tract. That's kind of where it's all at and where it starts. And then we have our famous disclaimer, the famous slide that everybody loves so much. But basically what this is saying is this information for your empowerment. It's not meant to diagnose, treat, or prescribe, or tell you what to do. What it is intended to educate you on what might be best for you and your body. And that there's no way that I'm going to know what's going on with you as an individual. And you might have all these different sensitivities or different medications or supplements that you're on. So it's really your responsibility to talk to your doctor or someone that you trust that can help you find out what works best for you. But here's some information and do with it what feels right and resonates, okay? All right, so a little background. I had chronic back pain starting actually since I was just before 16 years old. And they couldn't figure out why, because I was pretty young. At that time, I didn't have any major things that I was lifting. So this went on for years and years, and I went to different chiropractors, and I could not find the answer. I was just in chronic pain, and basically I just popped Advil like candy for a long period of time. It got to the point where when I couldn't move, they rushed me over to emergency surgery, found out I had a herniated disc that was actually pushing on the nerve where I could lost bladder control and paralysis in my leg. So it was pretty intense. what I decided is I wanted to be in healthcare as a pharmacy technician at that time. So I went back to school, tried to complete nursing. My back wouldn't let me. And I just kind of got stuck in what do I want to do, because I want to find answers, but the way that I'm doing stuff isn't working. And nothing touched, the chronic pain that I was in. So I was very into the conventional approach. I applied to pharmacy school, PA school. I got in. And then something just kind of clicked. My mom was kind of the renegade of the family. She was doing like these oils and herbs, and it petrified me. I'm like, what is this crazy stuff, and why do you smell so funky? And I was noticing that the people that she was sharing with were looking better. They were smiling more. They were kind of annoying me. And I was like, what's going on? Why are you people getting better? I'm going, and at work, and I'm not seeing people getting that better that often. So she gave me this big desk reference because she knew me. I wasn't going to touch the stuff unless I looked at the science. And I read it 2 times before I'd even picked up an oil or an herb or anything. And it helped me. So I was open enough to at least try it and look at it. And so then I decided that, well, if this works for me, but other people think it's crazy like I do, I'm going to go out and prove that this stuff has science. And I'm going to kind of combine this and help other people use it in a way that's medicinal and help this kind of movement move forward. At that point, I went to Bridgeport, which was one of the only school on the East Coast at that time for naturopathic medicine. And that began my journey, and then after practicing for a while and after writing for a long period of time, I decided to write this book and present it to everybody else, because I knew that I couldn't get out there. And there's lots of people with similar message to me, but they told me that I had my own voice, so it would be cool if I shared it my way as well. So most of these ideas aren't new. They're passed on from my mentors, and it's kind of my interpretation of it. Kind of take what you like, leave the rest kind of deal. And so that's the start of how it all started. So let's get on the same page here. There's going to be some definitions and terms I use, and if I say something you don't understand, please stop me. But we're going to discuss a different kind of medicine. So when I'm talking about conventional medicine or allopathic medicine, I'm talking about what's considered now the standard of care. So standard of care just means that the majority of the population believes that's what you should do when something comes up. Otherwise, it's not the right thing. Right? It's generally accepted as the public's viewpoint, and insurance will pay for it and reimburse it because that's what you're supposed to do. So these are MDs, DOs, they're allied health professionals, nurses. So that's what conventional medicine is. And then there's complementary medicine, so it complements it. It's used with the standard of care, right? But it doesn't replace it. Whereas alternative would be like someone that might be using, their blood pressure is high, but they don't take medication for it, and they decide to do something else, like acupuncture or herbs. That would be an alternative, okay? So those are the different kinds of medicine. And then there's integrative medicine, and that just opens up a big can of worms, because there's a bunch of different kinds of integrative medicine. There's 2 that I practice. There's naturopathic medicine and functional medicine. And they're both very similar, but they also have some differences and things that complement them. And this is what the model's kind of based on, right? So there's a lot of naturopathic doctors. There's a lot of functional medicine doctors. There's very few of us naturopathic functional medicine doctors. So I kind of, I'm bridging that gap. But the naturopathic medicine is what I was schooled in. And the philosophy is really based on that you guys have the innate ability to heal. So it's not like we're out there in the sea of horrible bacteria and that we're, pathetic and we need tons of things in order to survive. But it's the belief that your body actually is strong and healthy, and when things get off balance, that's when you need support from the outside to bring your body to be able to heal what it can naturally do for itself anyways. And that's through promotion of wellness, prevention of disease, and just striving for optimal health so that we don't get stuck in disease in the first place, because it's a lot easier to fix. It's a lot easier to prevent than to fix what went wrong, right? In the functional medicine, this addresses, both of them address the root cause. They're not just symptom suppression, okay? But the functional medicine I really kind of dove deep into because I really liked how it had a focus on biochemical individuality, which is a really fancy way of saying how does even one person that has maybe some issues with detoxifying, because there's a lot of toxins out in the world. Are you guys aware of that? There's a lot of chemicals that are being released that we don't really fully yet grasp on how they affect our health. So everybody has a different capacity to be able to do that. So how does different people's enzymes, and how does that affect what herb I'll choose or what nutrient that they need at a very minute level, as well as looking, so it's a microscopic level, as well as looking at the whole big picture of how what's going on inside the body affects what's going on the outside. What we do internally affects our reaction, and the reaction to our environment is going to affect our internal environment, right? So if there's a fire, that's going to affect how we behave. And if we're hungry and we have what they call the hangries, right, where you're really hungry, and if you look at someone and you're just seeing a gluten cookie because you're just so starving, you're going to be a little bit grouchy, right? So all these things affect everything else. If we look at the foundation of this new kind of way of thinking, what I'm going to do is bring you into what naturopathic and functional medicine is. Yeah. Mm-hmm. There's a certification. I'm gonna kind of go through both of them. Yeah. So it's really, there's 6 modules in functional medicine. It took me 6 years. Some people fly through them. They can do 2 in a year. But there's not a lot of us that are certified. But take them, and then you have to pass an exam that was harder than my boards, honestly, and you get a certification. So, but there's 6. Now, if we talk about kind of naturopathic medicine, so the difference between conventional medicine and naturopathic medicine really is the philosophy of kind of conventional medicine is treating a disease and trying to find a cure by suppressing the symptoms, most likely through the standards, which are mostly drugs, surgery, and other things that are covered by insurance. Whereas naturopathic philosophy is going to be based more on the principles of how people stay healthy and what's off balance and how can we bring that back into balance, right? And it's based on the healing power of nature, which I kind of already talked to you guys about, that everybody has the inherent capacity to heal within them, that we're naturally born where our body wants to be healthy, not where we have to be worried about getting sick all the time. We're a lot stronger than I think people think. A lot of people are scared a lot these days of what's going on in their body. And we identify and treat the cause. So if there's symptoms, we tend to not want to suppress them, because the symptoms are the body's way of communicating something's not right. And if we just shut that down, it's going to be hard to get to the root cause. And then it's kind of like, getting a bucket with a bunch of holes, and the bucket's not that strong and it's moldy, but you keep patching up the bucket and it keeps leaking, right? Because there's different, the bucket's trying to tell you, you need a new bucket. Will you please go to the store and buy a new bucket? But you're like, no, I don't have time for this. I'm just going to patch it up. And the water starts leaking out all over, and then you got all these other problems because you never dealt with the fact you just needed to replace the bucket, right? That's kind of what we look at as far as for the body. And then you want to we're treating the whole person. So it's not just like, okay, somebody's got an issue with their nervous system, so we're just going to treat the nervous system. Well, the nervous system also affects how your body assimilates nutrients, right? So if you're stressed out and your nervous system isn't working effectively, or you're anxious, or you have an issue with movement in your gut, that's going to affect how you digest and assimilate nutrients, and it's going to affect every other system in your body. So everything affects everything else. So people don't just come to a naturopathic doctor as like a walking liver or a walking gastrointestinal tract or a walking heart. They're people, and all of these things are connected. And we need to, we really look at how, well, you're on this, and that's great, it's helping your heart, but guess what? It's creating these issues here, so let's make them work together. And then, as kind of what I'm doing here, we're really big on teaching people on how to stay healthy and being the educator versus, somebody coming and saying, I feel this way, just give me something to feel better. Those people probably wouldn't work with a naturopathic doctor, because we don't want to do that. We want to be with people that actually come in excited and want to feel better and want to be educated and be in partnership with us, because that ultimately creates them not needing us anymore, which is great for them and a bad business model, admittedly, but there's enough people around him that need, this kind of support, so it's okay. And then we talked about prevention is the best cure. And naturopathic doctors they can be licensed, and there's also in states where we're not licensed, where people can call themselves naturopathic doctors, but they might not have gone to the the 4 years in order to get the doctor, as well as the residencies and all that. We're more considered kind of think of us as specialists in natural health. We don't replace your primary care or anything like that. We can act as primary care physicians, but we specialize in how to stay healthy. So it's a different approach, not meant to replace anything, but to kind of bridge the gap that's out there. Yeah. It depends on the state. Actually, that's the next slide, but I'll talk about that now. Depending on the state you're in, you could go to like a naturopathic doctor in Vermont. Like I have my license in Vermont, but obviously I can't use my Vermont license in New York. We're primary care there. So someone would go there and maybe, they have a genetic issue with cholesterol where they might need a medication for that. Well, if it's on our formulary is getting updated. Vermont might not have been the best example, but they can prescribe the medication as well as help with helping the body to stay healthy, to figure out why the cholesterol was high to begin with, or work with the genetics. And that's what I'll get into with the functional medicine too. It's really looking at falling in love with the patient, not the modality. Okay, so drugs aren't bad and herbs are good, or herbs aren't bad and drugs are good. It's really, we live in a world where people that were born today that are living thanks to heroic medicine that weren't thousands of, 150 years ago even. So they have these genetic kind of nicks in them that sometimes, certain medications can help them to optimize that, right? And then you use the herbs and the supplements to help them. And then there's other people who can do it completely natural, and then other people that don't even want to look at the natural. So it's kind of all a combination, and that's what we look at. So naturopathic doctors actually we are, as I know right now, unless there's another profession that's trained in this kind of public health safety of what are herbal drug interactions, and what are the side effects, and what are the nutrient depletion. So if someone comes into me on I think my highest number was 22 medications. That was my high number. And that was a long chart to research, because I go through all the medications. I look at how they're detoxified in the body, what nutrients they deplete, what they might interact with, what herbs I can and can't use, what the biochemistry is going on, and so I like that. I like that fun puzzle, but it's a lot of work. So we look at that, and different naturopathic doctors specialize in different things. So we all have this basic fundamental understanding of all the natural healing modalities that are on here, but then you specialize. So like the ones that are in bold are the ones that I really like to do. So I love this whole dietary and therapeutic nutrition, where I'm really looking at the person's biochemistry and looking at how they digest nutrients, and you can do some tests to look at if there's an enzyme that might not be as effective in processing certain nutrients. Like, has anybody heard of MTHFR and folate and all that? That's a big one right now. You can kind of go over that. But what it is it's if someone has a defect in that enzyme to process folate, they can have a lot of issues with detoxification or their nervous system or their mood, and you can test for that. The problem is right now is some doctors are only checking for that one, and it's missing the big picture of some other genetic differences and variants. So it's kind of opens up a big can of worms, but it's also a way to help people understand why they might not be getting results, with if they're already eating healthy and they're already doing all the right things and they're working out, but why they might not be losing weight or might still be fatigued, and you can really dig deep into the biochemistry and figure out what's best for the person versus what general base good advice was. And then essential oils are something I absolutely love and specialize in. I did them before I even went to school. I have like 15, 20 years experience with them. And I've done some writing and research on those as well. What I love about them is the oils are actually kind of a whole integration of the body, mind, and spirit in a bottle, because it affects the emotions just from the sense of the odors, how it goes to our emotional brain, as well as there's these plant, what they call secondary metabolites, meaning the plant takes the food, it metabolizes them, and creates these really powerful compounds that interact with our own cells and make our cells respond in a healthy, natural way and boost what's already there. And then as well as they have the emotion, the emotional, the physical, and sometimes even like a spiritual component to us, right? People use sometimes them to meditate or pray. There's lifestyle and stress management. I do have a bachelor's in psychology, so that's always fascinating to me, how you can have the best plan in the world for someone and they just don't follow it, and you have to figure out why. Well, if I get healthy, I have to deal with the fact I'm in a relationship with someone I don't really like, and that can be scary for people. That's actually one of the biggest things I hear when we get down and dirty to it. Herbs and essential oils, they wonderfully complement each other. I think that we need both. And then mind-body medicine. Those are my philosophy, what I specialize in. But you could go to a naturopathic doctor that specializes in homeopathy or acupuncture. Find something that works right for you. And if you look at the license date right now, there's 17. In order to be a licensed naturopathic doctor, you have to attend a 4-year postgraduate college. You have to go through these clinical rotations. You have to pass 2 boards. And now they're setting up more residency programs. When I graduated, I think my class was like 20, and we didn't have the hospital rotations and everything that they're coming now as far as integration. But those are becoming more requirements. They do now, yeah. They have in Bridgeport. They work in the ER and right alongside, and definitely more so on the West Coast, right? I don't know. You can write your senators and congressmen and ask them that question. We've been trying to get licensed for a long time, and it just doesn't go through. So there's some backlash, some misunderstandings we're trying to straighten out. Just exactly where our standard will be, where it fits in the picture here. So it is being looked at. It is being addressed at this time, but it might be, it could be next year, it could be 5 years from now. Usually, yeah, it usually passes on. Yeah, so we have like a lobby day every year and people that go up, but the biggest thing is mostly from the constituents. Like us naturopaths can say all that we want, and obviously we look biased. But when our patients come to Capitol Hill and say how, this is what they want, this is what they need, and it should be covered, then that's pretty powerful. Because you guys are the ones that vote. So that's the naturopathic. So that's my background as far as the principles I get in medication and the schooling I got, and then. Functional medicine is on top of that. This is like a postdoc certification, or sometimes there's nutritionists as well as health coaches that can learn functional medicine. But this is, like I said, it's recognizing that everybody has a unique biochemical, individualized way that they react with the world and even what we take inside our mouth. And I kind of talked about this whole internal and external environmental influence. It really looks at the different systems. So we'll go through I'll kind of show you a picture of what the different systems are of the body. So it really shows how everything is connected and how one imbalance can affect another body system. We can do different blood tests, and we also do, I can't in New York, so I'm not a licensed doctor, but functional medicine has tests that you can do, and I go through an authorized physician. Yeah. But yeah, when you get to those tests and those genetic tests, some of them are available to consumers, some of them the FDA won't let consumers do, some of them you can get some specialized testing for. Some of them I can pretty much predict after doing it for years what someone has. Like I can know if someone has a problem with breaking down stress chemicals just by the way that they're reacting and responding and the look on their face when they sit down in front of me. So I can get a pretty good guess of knowing that I might not want to give that person, extra what they call, specific nutrients that might speed up that pathway and make their stress hormones increase. And then we're also looking at promoting health too in the functional medicine model, so that it's not just about the absence of symptoms, but it's that the person has resilience again, so that if the same trigger comes up, their body responds in a more balanced way rather than setting them back again. So, and this is kind of like the model that's used. It's this functional medicine tree. So we're looking at these core clinical imbalances when someone presents to us. So if you look at the bottom here, these are the most important thing is getting a strong foundation in health. We're so focused up here, which is the symptoms, as a result of imbalances that go down the tree, right? So if we look at someone's lifestyle, I can do, not to brag, but a lot of people that are in like naturopathic and functional medicine, we know our biochem. Like we can manipulate someone's biochemistry to make it her. And they're on a lot of supplements to do that and tweak, and I could spend hours. I love that stuff. It's fun for me to do. It's what I do. I'm a dork. So, so that's cool. But, if they never get sleep, if they're not eating the right foods, if they're in a toxic relationship, they're stressed to the max, they're not moving their bodies, we're going to spend so much time trying to balance these and the symptoms, right? Really, the cheapest thing people can do is get this stuff right in the beginning. That's what the whole book's about. That's what, creating this foundation is first. Because once you do the lifestyle things, right, your foundation is strong, and then you really know what is imbalanced. And then the symptoms that emerge you can focus on. But if everything is murky and, the tree's tipping over and there's a big the weakest link. Wasn't that a show? The weakest link. Then you can, address that. So, one of the hardest things for people to do, if I tell them, this food might be reacting to your body right now, you need to stay off it, just, now until your immune system calms down and doesn't respond to it. I have had people cry in my office for that. It's hard because we'll get to that later, but there's addictive properties of certain foods now, too, that we have to deal with. So cleaning that aspect up and getting those chemicals and things out of the body can really help balance all these different things. So it's looking at how the body assimilates, how it transports nutrients, how things are communicated throughout the body. We think of like hormones and neurotransmitters, looking at the structure of the cell as well as the structure of the body, how that affects something. So I can give somebody feverfew and B6 till it's coming out of their ears for their migraine, but if they have a structural issue that's preventing circulation and oxygenation or something going on with their cranial nerves, it's going to provide temporary relief. So you need to look at that. And if I don't adjust, I have some great chiropractors that I refer to. I'm looking at energy, how the body defends itself, how it repairs itself, and a big component now in our world because of all the chemicals that are released in our body, released at a lot of fast rate into the environment, is how we detoxify and eliminate these things that our body doesn't need. Like if we're swimming in a cesspool of gross, it's really hard for our cells to get healthy and strong. So all these things interact. So what I didn't show here, but when someone comes to me, what we do is we go through the first visit is we're going through their whole timeline, their health timeline from when they were born to what brought them up there. And I mean, it's like a 2-hour consult with me, and by the time they're done, I feel like I know that, they're like, you know me more than anyone else, because we really dig into how do these things interact. It's important to me that you weren't breastfed. Like, I'm asking you, but I'm coming to you for my rheumatoid arthritis. Yeah, but the fact that you weren't breastfed means that your immune system wasn't set up to be as strong and balanced as someone else that got those nutrients and immune modulators in their system. So I know that might be a weak point for you. So let's not focus so much on the joints, but looking at the inflammatory component that might have happened, because then you got these infections, and then you had to take these antibiotics, and this is how it all connects. And if I don't look at that, then I'm just giving you stuff for joint pain. It's going to get you symptom relief, right? So, okay. So those are kind of the principles behind what this model is, or how I compiled this break-free medicine approach, okay? Why do we need it? So just kind of a raise of hands if you want to. How many people are satisfied with the health care that they're getting today? Okay. There's nobody here that has their hand up, Cameron. No, people aren't. I mean, this is really, I'm not sure this is the best quote, but this is what we got in the survey of people, that about 38% of Americans were seeking complementary alternative health care. They just did a new survey. The number went from, I think, 36% to 38%, according to the National Center for Complementary and Integrative Health. So these are the latest statistics, but I do think it's a little bit low, because when I looked at the survey, they left out a chunk of things that they couldn't measure as far as what constituted alternative and natural health. They're like, well, we couldn't really measure this or get the right questions for it, so we just left it out. It's not great science, but it's the best we got. So about 40% of people feel the same way you do. So this is why, well, if 40% of a population isn't happy and they're looking for different ways, we need to look at why, right? So kind of a big start of it, of how it got more into the public eye of people really, these complementary approaches getting more popular, is Gary Null. Have people heard of Gary Null? He wrote this what he did is this compilation with some other scientists and authors, and he came up with this review called Death by Medicine. Now, if that doesn't get media attention, I don't know what will, right? This is in 2004. And, you know, what he did is he said, well, what happens when people go to try to get well and they go to these hospitals or they go to see their doctor? Oh my gosh, there's side effects of them getting worse or getting sick. And so he looked at different sources and figured out that after about 10 years, 7.8 million people get sick from trying to get well. And at that time, it was more than any deaths from all the world wars that we had fought. So that's how many people died from trying to get well. We're talking about like people that had bed sores or side effects from medications or hospital infections, all these different things that cause people to get side effects. So that caused a little bit of a stir. And it, you know, if you get his book and you look at the references, or you can even get it free online now, because I just checked my source yesterday. You can even get it free, because I was looking up some of the references that he did. I mean, these aren't like, you know, airy-fairy references. This is like JAMA. These are like peer-reviewed medical journals that he's getting the statistics from. And then there's this, every about 4 years, this Commonwealth Fund, which is a research group that's for better health care in the world. They do these comparisons of industrialized countries and how they fare in health care, right? And every year, the United States has been last. So they do these like 11 industrialized nations, right? And so behind like the United Kingdom, Switzerland, Netherlands, New Zealand, you know, France, Japan, all these nations, we score last. And we also spend the most amount of money. So we're spending more and we score last, right? So that's not good statistics for our health. What's that? The price keeps going up, and 4 years before this, in 2010, this is 2014, they compared us to 7 industrialized countries and we were last, and then they compared us to more and we still got last, which isn't funny, but I did laugh at that. Because it's like, okay, were you trying to get more people in here to make us look less bad, and now we just look worse? That was one that we compared to. You go online; it's available too. If you look on Commonwealth Fund, they have cute little charts that are color coded, right? And what we compare to. Now, we weren't last in all of these measurements, but we were pretty close, like 5 and 9, and then overall we're like 11. But yeah, and Australia was one of the ones we got compared to, incidentally enough. So it's not good, right? So we need help. And an interesting component of, you figure that a lot of people are, actually a lot of the population is on medications or standard of care, and we're spending money, right? So we're doing what we're supposed to be doing. If you look at 2012, was suggested that 81% of the population was on one prescription in the past 30 days, right? And then JAMA, which is a peer-reviewed medical journal, quoted that about 60% of Americans are on at least one medication. So people are taking the standard of care, and we're still getting these results, right? And we're also finding that people are being over-medicated. So it's not like we're not doing enough, because especially with seniors, there's been studies that show even when they reach the baseline of what they need to for blood pressure or for blood sugar, they're not getting taken off their medication, not in the proportionate amount. And we don't know why. I'll go into physician burnout in a minute, because this isn't bashing of our physicians. This isn't bashing of medications. I'm not bashing. It's more of a discontent of how we're using the tools we have at hand to fix what's broken right now. Okay. So what has not been done is when they do trials for medication. Does anybody have science background or research background? Back if we look at like 8th grade science, how you took one thing, you put it against a control, and you see if it had an effect. Basic science, right? And if it did, yay, it worked. If it didn't, no. What they're doing with medications is they're doing that in controlled settings, right? So everybody's got high cholesterol, but this person has high cholesterol, diabetes, and they're obsessive compulsive, and they have all these different issues. So they can't be in our study because we just want to test how the drug does for cholesterol. So everybody else goes bye-bye. And we only use one medication because we want to see the result of that drug for that effect. So it shows that the drug is effective, but the problem is, how many people do you know that only have one condition, that only take one drug, that are in a controlled environment? Not a lot of people, right? So they did a cool study in 2015, one of the very few studies I've ever seen that actually tested what happens when we take these standard of care drugs in people that have more than one thing going on, that are taking more than one medication. Do we live longer? Unfortunately, for a lot of medications, the answer was no, we don't know. But there was some good results actually for heart medication, because you figure if your heart's going to stop, or if there's too much pressure, if you take a medication for it, it's probably a good thing till you can get that down. So there was some good things, and like I said, this isn't good or bad. There's some good stuff here, but there's also some scary stuff. There's a lot of people on things that might not be, they might just be wasting their money on or getting side effects. We don't know. Another issue is the reliability of labs. So how many people have something that they have going on, or they know that their thyroid is off, for example, or they know that something's not right, but all their labs come back normal? Isn't that so frustrating, right? So, functional medicine will actually do how's the body functioning versus if they got the T-shirt and they can join the club of the disease and diagnosed, population. But the problem is with the labs itself, right? So this journal Sentinel did this undercover investigation, and they reported this long printout, and you can get it online, 2015. They looked at different labs and how they got their accreditation. So accreditation means how do they get verification that from the government that they're accurate and reliable. I found a lot of them were doing some seedy stuff, and that the reliability of these and accuracy of these labs could vary from lab to lab. So you can go to one lab and your number could be this, and then you could go to a different lab and your number could be that, and then the ranges are going to be off. So exactly, because there's not standardization. So you're diabetic with one and not with another. It's all that, actually. Yeah, there's all that going on. So what we're trying to do in kind of integrative is just normal. Do you guys want to be normal? I know I'm not normal. I'm not normal. I want optimal health, right? I want to know that what I'm doing is optimal. How do they get these ranges? They put a bunch of people in a room that don't have symptoms, and the person that had this range at the very low end and the person that had this range in the high end, okay, then everyone in between's okay. But they're not. How do we know that they're healthy, right? Just because everybody fits in the average and that we're in their room is a size 2 shoe to a size 12. Well, some people still need a size 14, or a size 1. How cute, right? So there's all these different there's different issues with how we get diagnosed or how we're actually looking at what health is. And that's a big, big component here that I don't think people are looking at, what's actually healthy, right? And then there's the supplement scare. We see these media, you know, and all these headlines of, oh my gosh, these supplements and natural products are not safe and they've been tested, and the DNA, they're not even in the bottle. Anyone see that DNA? The New York State Attorney actually said, well, we did these DNA testing on herbs, and there's actually no herbs in the bottle because the DNA testing came out wrong. And that's actually not the right way to test herbs, or that's kind of an invalid way. So there's as much ado about it. But anyways, I just picked one of my favorite studies because I wrote about it and I really dug into it. But this came out in the New England Journal of Medicine. Okay, so I'm not pulling these articles out from, you know, integrative, airy-fairy, foo-foo journals, right? These are the big guys, the big gun schools, the big, taking a lot to get peer-reviewed, to get printed kind of ones. All right, so harm by supplements. There's a headline: 23,005 emergency department visits attributed to dietary supplements. And this is the headline in 2015. And this is over a 10-year period. So I was like, wow, you know, that's a big number. And we'll go to the comparison of medication in a minute because it's not really that big. But let's look at that. So what I did was I kind of dove into the statistics. When you look at journal articles, there's an abstract, which kind of tells you what the author wants you to know. And then there's the introduction, which tells you the background. Then there's the method, which a lot of people don't read, right? And it tells you what they actually did, how they got these numbers. So what I found was the majority of cases with young children, because they divided them into how many people died that were young, that were old, that were teenagers. 21.2% were related to the kids taking the bottle and swallowing it. So that's not related to a supplement interaction, that's bad parenting, right? So that's 21.2%. And then they, you know, of the younger generation, teenagers, older or younger adults, there was 25.5 that were contributed to weight loss drugs. So these aren't supplements. These are supplements that are spiked with a medication that were included in these harmful supplements. So now we're up to 21.2 plus 21.5. We're almost 50% of these deaths or emergency visits that are caused by supplements aren't actually caused by supplements. But it's better, because then they did energy products as another 10%, which are also spiked with drugs. Then for elderly people, this is a good one. The emergency department visits were actually related to them choking on the supplement. Okay, so now we're up to 37.6%. So if we do the math, it's 94.3%. It wasn't actually related to the interaction of the herb or the supplement itself. So my number, and you know, I'm not a statistician, but I came up with about 1,288 in 10 years. And that makes sense, right? Not everything's perfectly safe inert. Water can be toxic, drowning, you know, you can overhydrate. It makes sense. Nothing's inert and innately safe for everyone. But then the Natur-Tyme said, even they didn't do all that crazy math that I did because they have lives and better things to do. But they said that, you know, there's an estimated 70,000 individuals are seen at the hospital emergency department due to adverse drug effects. So even if you take the 23,000, it's 30 times more harmful effects of drugs. So here's just something I'm presenting to you. If we know that these are more innately safe, and you know, we're using standard of care that can have these harmful side effects and not getting the results, shouldn't we be using them both or looking at what's optimal for the person? That's all I'm presenting. And we know that in 2013, this is just an annual report in poison control, poison exposure. We know that there were no supplements in herbs in the top 5, right? But we do see that there's 3 medications that are listed in the top 5. So I implore you and beg you, when you look at these headlines in the sources that you're using, go back and see if that's an actual portrayal of what's actually going on, or if it's, you know, they could do this with drugs, through media, you know, anything to sell a story, and fear. Fear and misunderstanding will sell magazines. So. Yeah. I mean, it's not FDA approved, but there's things that supplements and herbs have to have some sort of standard. If like these what they call the pharmaceutical grade supplements, they actually have to pass these standards in order to be considered quality. So, but it's different. They're labeled as a as a medical food or as a nutrient or under food or under supplements. It's a different whole process than drugs. So it's like comparing apples to oranges, right? Like, how can you compare? You don't need an FDA approved to tell you that lettuce is okay to eat. You know what I mean? So it's kind of a different way of thinking of things. Okay, well, that's a whole nother can of worms. But let's just talk about just review where we've been. Okay, so this is kind of where we're at. So where I've taken you. Oh, let's rewind. Taking you into kind of these principles of how we can integrate and look at the whole person. And then I've taken you through what's going on and where we're at in healthcare and how we're not getting the results that we deserve, right? That people are dissatisfied and why. And I've told you that part of the reason is the methods that we're using to test these medications may not be attributable to the real world, that we don't live in a controlled environment, that there's funding and there's politics behind things that are being approved. And this is true in natural as well as in and the pharmaceutical world, but there's a lot of bucks on these drugs being able to work, right? And then there's the fact that there's so many new studies about different things that doctors can't keep up, so they rely on the FDA or outside sources to tell them what is and isn't okay. And that's a fact. I mean, like, I take off, I'm a geek, and a lot of my colleagues are. I mean, I take off a whole day to look over the literature with my clients, and they send me stuff, and I weave out 2 to 3 hours of looking over stuff every day, because that's what I feel I need to do. But I also don't take insurance. Mine's a cash-based practice, so I can give that kind of attention to my clients, because if I'm getting $5 an hour to see 10 people in a day, I have to see more people. So this is the way that the healthcare system is set up too. It's not so much can we get more coverage for what isn't working. It's let's look at the model and how we also treat our physicians as well, because I have a lot of conventional docs that are just as dissatisfied as you guys at what they're telling you, and I know that for a fact. So it's not the model is broke, so we need a new model, right? We need to look at moving from this war on the body, right? War on drugs, war on AIDS, all these wars are spending millions and millions of dollars, and nobody's looking at, well, how about how to keep, it's not as sexy as headline, healthy immune systems, healthy healthcare, how do we, paying for preventative medicine, headline on page 1, but if you get these war on healthcare reforms, what does, it's a bigger pull. And as a side note, remember how I showed you that Commonwealth Fund report about how we're number 11? So actually 2 days before here, they did, or maybe it was last week, a couple days ago, I read President Obama actually published in one of these journals, and he talked about his healthcare reform and how we are getting more coverage. But interestingly enough, the Commonwealth Fund said, this is great, we're getting more access, there's some slight improvement, but there's still an increase in chronic diseases that we're not even touching even with more access. So once again, it isn't about getting everything covered so much as getting the right things and helping people take accountability, I think, is a big component. And it's not what people want to hear, because they just want to kind of, I know I was hesitant when I first was introduced into this. I wanted a pill that was going to make everything better so I could keep eating my, aspartame soda and Twinkies and be okay. And it didn't work for me. I had to do a lot here. So healthcare is actually about what promotes health, and knowing that if you're going to have nothing against Twinkies, but if you're going to eat them and drink soda, your cellular response is going to be a lot different than someone that's eating a romaine salad and using olive oil. So it's going to be a different response. So how can we get people to know what's healthy? How can we combine? Because, like I said, drugs aren't a bad thing. The tools we have, they can save life. If someone gets in an accident and I want pump me up with medication and fix me if I'm in the car accident and can't move. So we need everything. How do we unite this, and how do we bring it together? And how do we get to the root cause rather than just covering up these symptoms and basing things on diagnoses that might not even be accurate, right? So we want to look at how to bring back also hope in healthcare, right? So many people are just so dissatisfied. And it's looking at these connections, that everything's connected to everything else, that we have to focus on balancing what's the best that we can use for the person at that time that's sitting in front of us, and how do these systems respond. So we know that, blood sugar can affect hormones. So people that might be having blood sugar issues, they might think that their issue is, low estrogen and low progesterone, and they've been taking bioidentical hormones, but they still aren't getting results. Nobody's looked at what they're eating or what foods they're doing or how their blood sugar is sending them, and they're signaling to their hormones off. So it's kind of like that tree. Is it firmly rooted at? So we need to look at how to root these and connect these all together. And one of the biggest things, which I kind of already talked about, is the biggest puzzle piece that's missing, right? Is this actual kind of respect of this doctor-patient relationship, this therapeutic healing property, patient empowerment, bringing doctors and patients together as a team, right? Because the reality is, in a survey of internal medicine in 2012, about 50% of the doctors are burnout trying to get people better. There's just so much as far as hours, as far as training, as far as paperwork, all of these things to take care of. And if they're half of the equation and they're already burnt out when you're getting to them, it's going to be really hard to get the advice to stay healthy, right? Because some of the symptoms of burnout are loss of enthusiasm, feelings of cynicism, and a low sense of accomplishment. So you're going to someone with your problem that's already just exhausted and trying to deal with their own stuff, but they know how to fix the symptoms, So there's this whole other component that underlies healthcare, and this is the art, not just the science of medicine. It's the heart of healing, right? There's this therapeutic bond that isn't really honored anymore. If you look at pictures like in the 1950s, 1960s, 1970s, and you show people pictures of doctors and patients, the doctor is sitting next to the patient, right? And they're holding the patient, and they know the power of therapeutic touch. I don't know if I have. I wish I did. But like if you look at the left and the right here, I mean, he still obviously very cares about this little child, but there's a barrier there, right? This is the new medicine. Don't touch your patient. Don't get too close. Don't get too emotionally involved. Just fix it. Versus, kind of coming together, and that doctors came to people's houses and they were part of their families. And I don't know if we can go back there, but there's a healthy balance. And there's studies that show, that it affects health outcomes. So this was a study in another British Journal of Clinical Psychology that showed how the doctor responded to someone having emotional diagnoses, mood imbalances. So someone came to their general practitioner and said, I'm depressed. And you have a practitioner that says, oh, I'm sorry, let's figure this out, let's work together, I'm here for you, versus, here, take this pill, whatever, bye. I got somebody run late. What's the result of that? And they found that when they did the study 3 years later, or 3 months, not 3 years, 3 months later, these people that went to a doctor that cared actually had lasting changes in their emotional health and outcomes. And it's not just emotions, too, because we know that this affects our physical health. So this is one of my favorite studies. It was back in 2009 in family medicine. And it showed that they actually tested 350 subjects. They had them fill out these consultation and relational empathy questionnaires, which is basically care, which is determining how present, how empathetic the doctor was when these people went to see the doctor and tell him, I have a cold. Just a basic cold. I have a cold. I feel icky, doc. What do I do? So out of the 350 subjects, about 84 individuals reported, wow, I had a great doctor. And they looked at these people, and they looked and compared it to the people that felt like, I have a doctor that just gave them medication or acted like they didn't care, were indifferent. And what they found is they actually studied immune markers, like these fancy cytokine names, like interleukin 8 and white blood cell indexes, and real lab tests, And they also studied severity and duration of the colds, and they found that the clinicians that were empathetic and their patients actually had less symptoms, their colds lasted a less amount of time, and they had actual changes in their blood markers from just somebody caring. And we know that. We know that when people actually just view people being kind to other people, it actually boosts that person that views it, their serotonin level, their feel-good level. Just think about it, right? When you see a dog or a baby or someone laughing, unless you're really, shut down, it's kind of hard not to feel at least a little bit happier, right? So these have significant effects. So bringing that all together of these philosophies, what are using the concepts between empowerment, knowingness, trying to take this, weave in this background of what's going on in healthcare in these different ways and how to bring it to our doctors. These are the concepts behind what breaking free is. So when I call it break free, it's breaking free of these old thought patterns that keep us in prison to not having the healthy bodies and life that we want. Because it isn't, to stand up here and be the perfect weight and look like a model. The purpose of health is so that we can live our life and not have to think about our bodies. They're not getting in the way. We can do what we want to do. We can be vital. We can go to our grandsons or kids' graduation and not worry about if we can walk up the stairs, right? Our bodies are meant to move us through life. So it's this application when we look at, this new way of looking at this genotropic principle. I like this word. It's not used a lot now, but it was a word, years ago that they used to show that every individual organism has a distinct gene reaction and nutritional needs. So giving everybody everybody needs, 2,000 IUs of vitamin D isn't going to create an individual that's healthy. Maybe a general population, there'll be less sickness, but it's not going to create the optimal health for everybody that needs it. And I talked about how different people have different variations in their enzymes that process different food, and we know that there's interactions between, say, somebody that has a genetic variation in how their body metabolizes choline, really fancy PEMT, SNP is what it's called. I won't get too crazy with that, but an estrogen affects how well that enzyme works. So somebody that's pregnant or postmenopausal that has a choline deficiency, which is a form of B vitamin, that also has this genetic predisposition to not be able to process it correctly, that's somebody I would look at as giving supplemental choline, right? So you can get really intricate and really individualized with these principles. A lot of people don't need to, though. Just not to scare you. I get the people that need me to do that because nothing else works for them, so we got to go dig deep. So that's how you get geeky in this stuff. But I can tell you, a lot of people, if you go into the general roots of just the healthy diet, looking at the relationships, looking at your sleep and taking care of you, I would say, about 80% of people's issues, 50 to 80% of people's issues would get better. And then you can really dig deep into doing this fun stuff if they're not. And it's also about, kind of the synergism of balancing, when to go to a specialist and when to, know the general stuff has worked and just taking care of ourselves in one way. So the genetic variance is an example of partnering with your doctor. It's about knowing that certain supplements work together, like curcumin works okay with this secondary plant metabolite called resveratrol, but maybe not so well with N-acetylcysteine, which is used a lot for liver detoxification. So someone could be spending their money on both of these guys and not getting as good of effect as if they use these two together, right? So a naturopathic doctor or functional medicine doctor would know that. We know which type of vitamin E to use for stents because we know that vitamin E has gotten some scary headlines as far as not being good for the heart, but it's the form, right? It's the form of vitamin E that they're using that makes a difference, as well as when they do nutritional studies, it's not as easy as testing for a drug that manipulates our biochemistry. If a person doesn't need a nutrient, it's not going to create an effect, right? So a better test would be to test if these nutrients work or if are harmful is first test if the person needs the nutrient before you give it to them, and look at what the form is versus, it's easier if everybody has high cholesterol and you're just getting down their cholesterol with statin, right? But not everybody needs vitamin E. You can do tests for that though, or you can look at symptoms. Good doctors in New York State, I have to be pretty darn good at symptoms because I can't run a lot of tests a lot and it hurts people's pocketbooks. So I've gotten pretty good at correlating nutrient deficiencies. They teach us in functional medicine too to look at people's nails, their tongue, their skin, their hair, do a whole nutrient assessment and look at, you have white dots on your finger and your hormones are off and your blood sugar's off. Those can all be, put those together, you might have a zinc deficiency, do the zinc taste test. So you can compile all these pieces together as well with a knowledgeable physician without necessarily testing, but like these fat-soluble vitamins, it might be a good thing to test. They can test those. That was just so I didn't have to write like 16 lines of saying this, this dose actually worked well with supporting it, and this dose didn't, and it, depending on the dose, it helped it or hurt it. Honestly, I think it was the ECGC, but I can't remember because I think the study was, I looked at it like 6 years ago. Depending on the dose, not necessarily, but it could be. Basically, they might not be working as well together. So it's just an example of when they did the studies and they showed combinations and how they worked on the mechanisms of action. It's the difference between someone saying, I have inflammation, I'm going to throw the kitchen sink at it and hope that it gets better, versus an approach of, an individualized approach of, well, these supplements could interfere. Let's see, you might still need the green tea in the cooking room because you have other stuff going on, but let's look at how those respond in somebody's body versus just taking them because it's a hot thing right now. Right, right, exactly. Okay, yeah, and some people, that's, it depends. The basic point is everything depends on here, right? And that things can interact, right? So St. John's wort with antidepressants is probably the most famous thing if you're taking a drug with a medication. That's because of the way the body metabolizes. So, or grapefruit juice. A lot of people know they can't take grapefruit juice because of the way that it affects the liver metabolism with their heart medication. That's a whole different branch of yeah. Some people, I do have certification in applied kinesiology, but I don't use it as much. There's some really good docs that are diplomates that do it that I feel like you really have to know what you're doing with that in order to not bias the results. And I honestly don't think I'm good enough at testing people to not bias the results. So I use different measures, but I know about it and I know the science. My mentor did it. My first mentor I started out with. And then kind of just going back with I don't want to beat a dead horse. I hate that expression, but anyways, nutrigenomics is just looking at how different foods interact. This is one of my specialties too, how they interact with the cells in our body. So we know that what we eat actually sends signals to our cells and makes them respond either good or bad. Cookie and donut versus broccoli and kale. But we also know that things like even that are potentially good foods could affect different people in different ways. So if people are eating soy and it's fermented and it's quote the right kind, but their digestive tract is off and they can't break that down, and their belly bugs might not be able to break them down, the soy products, into healthy components that balance their hormones, they might not get as good as effect as somebody that's also looking at, fermented products and balancing the gut, which I'll get into a little bit later. Or we know there's been lots of studies that cocoa is really good for heart disease lately. Like chocolate lovers are uniting everywhere and throwing parties. It can be great, but for people that are caffeine sensitive, right, they might have a genetic variation in caffeine, it could actually not be great for their heart. It could actually be harmful. How do you know if you're caffeine sensitive? If you're like that split is if you drink coffee and you're like at 3 o'clock and you're still wide awake and laying in bed. You might not be someone that would benefit from cocoa as much as like my roommate in college that was drinking espressos at midnight and then falling asleep at 1. Yeah, so you have those people, and she eats a lot of chocolate, and she's got a healthy heart. So these are things, and then just bringing also back, into the whole aspect of healthcare and uniting the expert. You think of, I kind of think of like doctors and integrative practitioners that really kind of are looking at the whole picture. Is if we make the analogy with kind of like a car mechanic, I think people know how to put gas in their car. They maybe even know how to change their oil. But when you get into the complicated stuff of like fixing the engine, people can do a lot of studying in books themselves and get pretty healthy and have a run in a car that's won't break down on them with good gas and good oil. But when you get to the complicated stuff and you're just looking at the engine and using YouTube, it can create some problems. So trying to find doctors that are experts, I think, is a big component of this. That you wouldn't, just try to fix your car yourself, but a lot of people are getting so dissatisfied with healthcare and doctors, they're trying to fix themselves. And that's what I think we need is these new doctors, like functional doctors and naturopathic doctors and integrative doctors that are looking at the picture so that they can be the experts that people trust, not trying to fix people or just throw, a supplement at them, but to actually be in partnership. And I think that's a big component in health that we need, because when people's bodies break down, that emotional connection is just as healing, which I showed you. And the same thing with food, because, I'm going to get into this now, kind of, the whole thing with this compassion as we're changing, right? This is a lot of information, especially for people that are new. 4 years or 5 years or 6 years ago when we started off doing these talks in naturopathic medicine, I would say the word GMO and people wouldn't even know what it was, or people wouldn't even know that there's a lot of chemicals in the environment. And now there's so much more awareness. And it's easy to be judgmental. It's easy to be like, okay, everybody should be just not eating junk and gluten-free and, taking their vitamin D and exercising and doing yoga and meditating. What's your problem? And there's a lot more going on with that, because these chemicals that we're exposed to and these things that we thought were okay to be eating are actually addictive, right? They're actually creating biochemical responses in our body that make it hard to stop doing what we want to stop doing. Like an addiction is not being able to stop doing what you can't, you don't want to do, right? Because we know that food can be addictive, right? We know that some of these, when they do tests on people and they look at their brain scans, that some of these sugar can light up similar brain responses as cocaine or heroin. When they do rodent studies, they actually they put a rodent with sugar on one side, cocaine on the other, and then you can tell how much the rat wants because it presses a little pedal and I want more. And when they do that, the rat's actually cocaine or sugar. Which one do you think they go to? Isn't that fascinating? Right? And they're doing more studies to figure this out. How come some people get more addicted than others? And they're finding, there's environmental factors, there's genetic factors, and dopamine receptors is a big thing right now. I just read a study actually this morning on dopamine receptors and alcoholism. But the dopamine receptors are, what makes something pleasurable, and they're finding that people are genetically predispositioned to be more addicted to food. Because you have the people that have a bite of chocolate cake and they put down the fork, and it's so annoying, right? And then you have the people that are like, I don't even want to have a bite because I'll be done with the cake in 2 minutes. What makes the difference, right? And it could be their genetics, it could be their blood sugar off. All these different things are components. And I can sit up here and say everybody have a healthy diet and it's going to fix medicine and you're going to be 50 to 80% better. But if you're one of these people with a dopamine receptor and having these chemicals running around in your blood for a while, a period of time, I always say that biochemistry will trump willpower every time, right? You know what to do, but your body won't let you do it. Why? Right? So we have to look at the underlying issues, these neurotransmitters, these hormonal imbalance, these blood sugar issues, these gut bugs. Who's heard of the microbiome? I'm going to get into that a little bit. These belly bugs that live inside our gut that send signals to the rest of our body, and to process, digest food, immune system, all that stuff. Very, very big piece in science right now. So emotional components, right? So the women that cry in front of me when I tell them they might be sensitive to gluten, right? Why are they crying? Well, when I was 6 years old, whenever I was upset, I'd sit with my grandma, and she would give me a piece of cake, and we would talk, and I would feel calm. So the cake that you're telling me not to eat is telling me that I'm going to lose that connection to my grandma who passed away 2 years ago. Oh my gosh, what if I never ask that question and I'm getting mad at her for not giving up the cake because she's gluten-free, and can't she see that she needs to be gluten-free? You know, these are big components. These are just as big as these fancy tests that I'm doing, right? If not bigger. So just some basic things, what to eat for maybe people that are a little less complicated, which I don't see in my practice, but a lot of people do. You know, just basic grandma stuff. Eat your veggies, eat your fruits, eat your fiber. You know, this gluten, soy, dairy stuff, I didn't have time to put it in this presentation, but there's evidence. Let me make it real simple. If you have inflammation or something going on in your system, there's inflammation in your body, these things can cause more inflammation and imbalance, right? If you're pretty healthy and your immune system's okay and you eat it and you don't have too much going on, it might be okay. But there's studies that do show immune responses to these foods in a lot of the population now because of the way these foods are processed, because of the way that our gut is. The testing that they're doing isn't always optimal because they might be looking for celiac markers. These people, that the markers that they're using might be deficient in a certain immunoglobulin that they're testing. It gets pretty sneaky. Some of the studies that I took out, actually, I did have like a whole thing on gluten, but some of the studies are showing it's a whole different response pattern in people that are gluten sensitive, and the innate immune response, or what's going on underlying the small intestine, is a whole different response than the autoimmune response of celiac disease. Well, because of the research that I've read, a lot of times I just recommend a lot of people get off gluten. At least, well, you know, their immune markers are off, or if there's any sign of inflammation. The gut in your immune system, most of it's in your gut. So if you're continuing to eat food that's going to inflame you in your gut, then I don't have a fighting chance, you know. So do I believe that everybody needs to do this forever? I don't know. The jury's out on that. I know people that will say gluten is bad, it's going to kill you. I just know that years ago that wasn't true, and people were healthier and they were eating gluten. So there's something going on in the environment, you know. There's very few studies, but there are some studies. I found 1 or 2 small studies that show that this ancient grains, they did a small study with 8 people, very small, but they actually had these ancient grains, and they did not produce the lab diagnosis markers for celiac after they ate the gluten. Now, if they had other responses or biopsy, I don't know. So it's compelling. It's very compelling. I know people that are very sensitive to gluten, and they go to Italy and they're fine eating that. You know, why? Some people say it's the glyphosate, right? It's the pesticides that we spray on wheat, even if it's organic. So there's all these different factors that are going on. So with that kind of processing, and then if you guys are geeks and you really want to look into a fascinating paper, I recommend Stephanie Seneff's paper on glyphosate and celiac disease. She goes into biochemistry like it's out of style. I like so excited. It's a really cool thing. Feneff. Yeah, I can't remember the name of her research partner. Oh, I feel bad. It's recorded. He's really smart too. These are just references that show you everything I've been talking about actually works. That if you change your lifestyle, you're actually going to get changes in health. You know. And you know, there's a lot more where this came from. So. All right, so that's kind of the background of how to stay, this new model of staying healthy, why we need it, and I just kind of want to give you an approach now that we know there's some imbalance. So the book actually goes through these different systems. I start with the gut, go to the brain. Because if you have a bunch of stuff that you can't digest and you can't process and making you inflamed, none of this other stuff is really going to work. But then at the same time, some people were like, well, if your brain is on fire and you don't look at that, it makes the choices to make you process what you're going to pick up to eat. So just because it's in this order doesn't mean that it has to be done in the order, but that's kind of the way I figured it out in the book. And sometimes, you can't safely detoxify unless these other things are in place. Like if someone's got a gut that's inflamed and they're trying to cleanse their liver, it's not going to go out their bum. It's going to go back into their system, and they're going to get negative responses to a cleanse. Bad rookie mistake I learned the hard way, right? So just something to be aware of. Oh, everything's wrong with me. I need to cleanse. And your gut's inflamed and you're still eating junk. Watch out, So that's why I kind of went this way. So their hormones are imbalanced, their blood sugar, their brain, their gut. Now let's kind of get moving here, Okay, we'll go into that. Yeah. So what we're talking, here's the importance of the gut, right? So it's kind of what it does. Digestion, assimilation, immune modulation. There's these little critters that live inside and they actually live inside our whole body and outside. And do you guys remember Pigpen? I'm just going to throw this in here. Do you remember how he had that cloud around him? They did a study that found that people have their own microbial clouds that they have around them, and that you can actually go in someone's microbial cloud, and that could be how you get sick or how you get positive immune responses. I posted it on one of the blogs I do. But it's just like we're all little walking pig pens, and we can't even see the little bugs around us. So initially, until recently, we thought we were a lot more bugs than cells. But some guy did this cool, fancy statistical thing that I kind of did with that paper, but he went to the nth degree and actually found, well, they weren't actually counting all red blood cells and blah, 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 so it might be more of a 1-to-1 ratio. Regardless of bugs to cells that we have in our body, they're really important. Like, these little critters interact with our cells, and they tell them what to do and how to process. We kind of think of how, when you ferment something or ferment food, the healthy bacteria breaks down the food and processes and makes it more healthy for you, and you get more calcium and all these benefits from fermented food. That's what we got going on in our system, right? So they do a lot more. These are the studies, what they do. They actually send signals, to our immune system. You have to think of what we eat is the inside, is bringing the outside world into our inside. And so there's these little things that line our insides to tell us, is this friend, is this foe? What signals should I send to our cells to what to do with it, right? And what signals can I send? And then you get down into the actual gastrointestinal tract, past the stomach, past the esophagus, and you have these little guys that send out our neurotransmitters, right? 60 to 70% of our serotonin isn't here, it's here. Why? Because serotonin helps movement in your gut, right? It actually helps what they call peristalsis, serotonin. And it does other things too. So all of these are actually finding is happening in our gut. So when people say they have gut feelings, they literally scientifically do, right? Affects our mood and behavior. They used to do studies with rats. Those poor rodents. But some of the studies are funny because how you know if a rodents are so scared of water, right? So they give rodents they make them anxious, and they give them this form of probiotic, this species. You have some of the rats that are like floating in the water, all happy, they're like chilling, they're like less anxious, just from eating this one, different strain of a probiotic. It's fascinating stuff they do. They help us detoxify estrogen, right? So women that their hormones are off balance and they're just going after the liver, and they're, you should be balanced this and you should be on hormones, but nobody's looking at the estrogen metabolism. We actually detoxify more in our gut now, they're saying, or as much as in our liver. There's as much detoxifying going on here. That's what they're finding. So what happens when we harm? How do we harm our gut, right? So some of the biggies are certain medications. We know that non-steroidal anti-inflammatory drugs. I used to take like candy actually can cause leaky gut, right? Which I'll get to in a minute. I didn't forget your question. Alcohol, food sensitivities or allergies. think there might be one person I have that's not on a digestive enzyme, because I hate to do generalities. But unless you're eating in a state of calm every time that you open your mouth, and your whole life is pretty cool, and your body is completely balanced, it's really hard to produce the correct amount of digestive enzymes you're having with your food and breaking it down, right? So I do have most of my people on digestive enzymes, because if every time that they're eating and they're getting big chunks of protein and immunomodulators that are causing their immune system to go, this isn't properly broken down, let's create some inflammation. Once again, everything else I do, I'm trumped from the get-go, right? So the first thing I got to make sure is that they're digesting their food, because everything else, they can have all the right vitamins and all the right nutrient deficiencies cleared, and then they're having a big glob of apple that isn't being broken down, and they're, salicylate sensitive or something. I actually have because I'm a practitioner, I can prescribe or specific supplements that you can't really get. But I can tell you here, they do have some. I don't know if I can say this on YouTube. Some brands that are very good. That I have clients that don't need that strength. I'll say it when the cameras go off. Okay. I just don't want to get in trouble, because I don't know what their sponsorship or whatever is like. Because there's some that are good and some that I see and I run. Okay. And then stress. Did you know that stress can actually literally eat away at the lining of your small intestine? Oh my gosh, isn't that scary? Yeah. And then there's like blood sugar, bacteria. So we want good bugs, but we want the right community, right? So you kind of want, like, there's these bugs that are bad when they overpopulate. So it's like when you have a party, you want a couple of people there that can create trouble because it keeps it interesting. But you don't want like the whole clan there at the same time. That's when you get the disease, right? So they need to keep it interesting and give us the right, signaling, but you don't want them to overflow. So what happens with this leaky gut, right? So this is don't go to your doctor and say I have leaky gut. The correct term is intestinal permeability. That's the proper term. It's when the lining of the gastrointestinal tract is damaged. Okay, and by all those factors. So who doesn't have a leaky gut? I want to know today, right? And what happens is the filtering mechanism breaks down, and things that are supposed to stay in the gut and be processed and used effectively to the body for health actually don't get processed that way. It creates inflammation. It can actually cause systemic responses because it's exiting out of the gut where it's supposed to be processed and going into your bloodstream. Easy, right? So people can say, I eat gluten fine and I have no symptoms in my gut, but they have joint pain and they can't lose weight. Leaky gut maybe, right? Because what's ending up happening is they have systemic inflammation. When the body's inflamed and it's storing toxins, it won't release weight. Okay? So these are all, different, and they're little critters. If we keep them happy, there's actually a probiotic called Aspergillosis that actually helps keep the lining tight and nice. One of the most researched probiotics. If you guys go to my website, it's just Google BreakFree Medicine. I just did a huge geek out blog on probiotics. There's a bunch of links on them, so that you can look at some of the science behind there. But one of the yeah. 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 I get people that yeah. People with like small intestinal bowel overgrowth, where they have overgrowth in their small intestine, they take a probiotic, it can make it worse because there's bugs there that shouldn't be and they're growing them in the wrong spot. You have the whole aspect of we can't even begin to fathom what's actually down there with just getting methods to look at all the different critters that are in there. First they said 500 species, now we don't. The biggest strains you can get is like 14, and everybody has their own microbiome fingerprint, right? So somebody that this probiotic worked great for, you give it to someone else, it's not gonna. So I tend to start off with actually single strain in my people that are very sick, and the ones that are researched that I correlate to with their symptoms. That can get very complicated. Now, I'm getting complicated because I have complicated people. For most people, they can take a big strain, probiotic, and they do better because their body needs it. And the ones that are most researched for human strain usually do good. I like to go, the most I've ever gone, one are Healthiest 14. I tend to start with like 5 and like an Aspergillosis with my people, just because, like I said, I don't want to throw off their own microbiome. We all have different bugs, as we all have different cellular reactions. So that's going to be the next science, I think, is really getting deep into these probiotics. I have people that just take a probiotic and it saves, like, everything got better, and it was like, you know, that's what they needed. They found the right thing for them. So it all depends. Well, that's. I'm going to skip forward. Oh, I didn't have it. Darn it. Look it out. Okay. Oh, here. Yeah, it's right here. It's right in front of me. So, a healthy gut. What do you do first, right? So the first thing for people that have their guts that are off balance is that you remove the trigger. So if they're having an issue with a probiotic, you don't keep giving them the probiotic, right? You've got to figure out what's causing it. Is there an overpopulation of bad bugs? Do they need an herbal and antimicrobial? Do they have a parasite that maybe even need a pharmaceutical grade or essential oils or something? So you have to remove the trigger. You have to get, how do I find it out? I do a 2-hour consultation and tests and labs, yeah. Replace their enzymes, and then I tend to do bacterial. Now, I will say a lot of times I start off with people on Aspergillosis, because I find that one is very. There was a couple people that had a response with, but I really like that one. It seems to just, what I think of as Aspergillosis is like the general. He goes in there and kind of makes sure everything's cool and sets up the campground, but doesn't necessarily put the wrong ones in. He's just like, all right, you know, there's a bad party here. I'm gonna clean. I'm gonna make this livable again. I'm gonna keep things balanced, and then you can bring in the ones that the body needs. I don't think we're there yet, and I probably read about 5 studies a day just on the microbiome. I don't think that we're there yet where we're finding that the right species that's right for everybody, but I do think it's coming down the pipeline. You guys can do these tests too, where you can get your microbiome checked. With like American Gut Project, Ubiome, send in your poop sample, and the scientists look at the poop sample. Love science, right? And then, you know, restore. So this is just kind of like the 5R approach we learn in functional medicine. So your question was, what was your about the probiotic? Did I answer that? How do we know? Sort of? Yeah. Okay. Sort of good enough? Yeah. All right.
Well, it's sort of elimination and then it's introduction. You say you start with the Aspergillosis and find
I find most people, and that's just my experience, like, you know, the population of people I'm getting to. Yeah. So they tend to do good with that. There's a specific brand I use, strain. But, yeah.
You get some big results you want to go further.
Well, like, I'll give you an example. I had someone that was on 100 billion probiotics. They got a really good brain. That's a CEU. There were 100 billion little critters. Now that's like pennies to what's actually in our body. These guys are not working by the amount. They're working by the immune modulation that they do in our system. You can't swallow 100 billion dead bugs, and because it's a bigger number, get better responses. That's not how they're showing their work, right? So how they work is what the little species are communicating into the body, and how that's creating or restoring gut health, right? Because they even show that's my whole blog this week was, so probiotics don't change the microbiome composition in the poop. I don't care, because they do other things, right? So she was taking these, and I was trying to tell her, you know, you have fungus overgrowth and you're taking a large dose of probiotics. Like, let's dial that back, because what if you're feeding the wrong guys with that big of a dose? And it was very hard for me to convey that she was doing the right. She might be doing what appeared right, but wasn't right for her. You know what I mean? So, general rule is don't be insane. Don't do something over and over again and expect different results if it isn't working. If it isn't working, stop it and look and do something else. That's the basic rule, right? And then just, there's the basic stuff. I like to start with an enzymes. I usually, most people I feel, if they have a chronic health issue, we know that leaky gut is related to any autoimmune disease. You need trigger, you need genetic predisposition and leaky gut, and you could have an autoimmune response in your system, okay? So these are some things and some pretty safe supplemental support that most people can do well on. If they do betaine hydrochloride, which helps your body or helps your stomach break down proteins and get minerals in your system, just make sure you don't have an ulcer because that can be contraindicated. But removing some of the obstacles, here's where gluten will cause a transient leaky gut for everybody, even healthy people. So that's why long term, if you're already inflamed, it can be a trigger for more so. And then doing different testing, and then just feeding and loving on those little bugs because they're a big component of health, right? So they've actually done studies where omega-3 fatty acids, zinc, and then I always put the right probiotics can feed the right microbiome for you. And exercise and healthy diet actually helps too. And then I use essential oils because they do more than one thing. So they've done some. They haven't done human trials yet, but I've seen clinically with my people that it doesn't seem to upset their gastrointestinal tract, and at the same time it can kill off some of the bad guys. So if we take, for example, like just taking peppermint, if someone has these gastrointestinal chronic symptoms, we know that it works on pretty complex mechanisms as far as helping calm the gastric system and motility in the gut, as well as helping digestion, helping inhibit microbes, helping the body boost antioxidants. So if there's inflammation and damage, helping the body clean that up, helping symptomology. It's one of the most studied essential oils for people with IBS. It's peppermint and its clinical utility, right? And then on an emotional level, people that have gut symptoms are often unfocused, have no energy, and don't want to exercise. So just with that inhalation, they've done studies in athletes with peppermint where it's actually promoted actual changes in their, when they do studies like a forced expiratory volume and lung function and focus and all that, when they give the athletes a drink of peppermint water or they diffuse it in the room, they've actually shown increased responses. There's controversy in that. I use a specific brand that you can take internally. You have to read the label because not all of them are safe to take internally, and they will say do not ingest. Don't use those for that. The ones I use are all safe for ingestion. And you can get enteric-coated peppermint oil too for people that, because it does affect the digestive juice in your gut is affected by stomach acid, affects the essential oils. But the good thing with essential oils, if they're natural too, is you can just rub them right on your gut and they get absorbed into your skin within 20 minutes, usually out of your system in 4 hours. There's usually no how you know you're using too many essential oils is you'll get a headache and you'll just be constantly peeing. It's really annoying. So. On the esophagus, yeah, that's why they do for people that, for people with esophagus, with kind of issues with that's why they do the enteric-coated. Yeah. Peppermint tea is about 20 times less potent than 1 drop of peppermint oil. The oil is it's distilled and it's actually, more concentrated than the tea or the herb. It's actually taking kind of like sucking out all those constituents and putting it in a very concentrated form, and that's why you only need like 1 drop, like 1 or 2, 3 drops a day. It's pretty strong. Yeah. Here's are some references. So that's kind of the approach. If we close right now, bringing you through where we've gone, these two kind of principles and philosophies of naturopathic and functional medicine, where we are at conventional medicine today and why we need them, looking at these different philosophies of bringing the patient and the doctor together, right, and looking at how to rebalance the body in a systematic way. Now, you don't have to do it my way, but just maybe even just being, exposed to this kind of thinking, and then thinking of how do I treat the cause? How do I look at finding somebody that I trust if I'm stuck? How do I go to the root of what is healthy with some of these lifestyle factors? And is this medication the best thing for me, for my system? Is it, or am I just looking at the symptoms, and how do I dig deeper and find out what the cause is? All right. So that's that, and I just want to leave you with a quote here. It's one of my favorite quotes, and it's often quoted a lot. But it's more important to know what sort of person has a disease than to know what sort of disease a person has. Right? Everybody's different, and they need different things. And you guys know your body better than anybody. Anybody that's a geek like me, or any, the most important thing is how you feel and your feedback. So, and remember, you can always fire your doctor and find a better one. They're your consults. You don't have to be afraid of that. Okay, so that's that. Are there